So as I'm trying to help you select what size you would like to be and what the final implant is that we will use on the surgery, I will discuss with you at length what it is that you're looking for in terms of projection and volume. Are you trying to be proportionate? Are you trying to be a little bit larger? And I will guide you to the appropriate size. I often would like the patients to give me their input on both the balance, what kind of clothing they wear, what kind of activity they have in their life, because if you're very active, most patients would not want to go larger. Your options for breast reconstruction incisions are really dependent on where the tumor is located. If we're planning a skin-sparing mastectomy, which means the nipple complex is near the tumor and the nipple is going to be removed, your incision will be across the mid-mound. And that can be either in the horizontal or it can be in the vertical. Typically, you will have a vertical incision if your breast needs a little bit of a lift. The other alternative incisions are lateral, an inframammary fold, and a periorelar incision. So an inframammary fold incision is in your breast crease at the bottom of the breast, and that allows us to spare the nipple complex, where the breast surgeon will perform the mastectomy through that incision, and then my team will come in and do your breast reconstruction either with the direct implant to implant or with the tissue expander. Lateral approach is where we go from the outside of the nipple straight across towards the underarm. As far as a periorelar approach, that's often useful for patients that we're trying to minimize the scarring. They have a lot of healthy tissue. Breast implants for reconstruction are placed either above the pectoralis muscle or below the pectoralis muscle. You do have the option to state your preference. There are advantages and disadvantages to both though, and primarily the major disadvantage to underneath the muscle is either an animation deformity or muscle, what we call window shading, where every time you pick up something or bend over, you're going to notice the pectoralis muscle is going to contract and it may shift the implant. So in other words, your implant may move a little bit up and down every time you use your right upper or left upper extremity, depending upon which side is reconstructed. You don't see that at all with above the muscle reconstruction. So the disadvantage to above the muscle reconstruction though is that if you're thin skin and have very little subcutaneous tissue, you may require additional surgery such as fat grafting to hide the profile of the implant. You may need fat transfer for the reconstruction as a staged procedure, especially if you have thin subcutaneous tissue which shows some of the rippling or the margins of the implant, or the dissection from the mastectomy took more breast tissue or subcutaneous tissue than desired. And what happens then in the reconstruction with the implant or the tissue expander is that you're going to see what we call a soft tissue deficit, or like a divot in your skin, and that's usually at the upper pole of the breast, or the breast may have been removed and the skin flaps left very thin. So fat will help you to thicken that skin flap and to make any of the margins less visible and less palpable. If you require fat grafting, it's very helpful to improve the contour of the reconstructed breast, give a smoother finish to the outcome, and to correct any little soft tissue defects that may have occurred from the mastectomy surgery. The fat is harvested typically from your abdomen. It's then harvested into a device that allows us to wash, rinse, and filter the fat, and then inject it back into the body in very small volumes in the areas that we want to improve the contour for you.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.